Welcome, everyone. We're so glad you're here. I'm Stephanie Roselli. I'm the executive editor of Griffin House Books. And today we are delighted to have Dr. Sarah Taylor Vanover. She is one of our terrific authors. She is presenting on the public-private partnerships to strengthen early childhood programs, and we are delighted to have her. If you aren't aware, she is a trainer in the Commonwealth of Kentucky, and she is the Policy and Research Director of Kentucky Youth Advocates. Sarah's latest book is Bridging Gaps, which you see on your screen, as well as a few others. These are our spring releases for 2024. We're very excited about them. Please connect with Griffin House on social media to get all the early childhood education inspiration, activities, expert tips, book recommendations, and more that we offer. You can connect with us through Instagram, Facebook, LinkedIn, what was formerly known as Twitter, and Pinterest. For our book chats, we offer 20% off if you order through griffinhouse.com. Just use the code BOOKCHATS. Dr. Sarah Taylor Vanover has been working in the field of early childhood education for more than 25 years. She's been a teacher, a director, a trainer, a college professor for other early childhood educators. She served as the director for the Division of Child Care in Kentucky and she supervised child care development block grant funding. I'd forgotten about that, Sarah. And she's currently the Policy and Research Director for Kentucky Youth Advocates. She's focusing on early childhood education, policy, and research, and developing positive outcomes for young children. For the past several years, her work and research has been focused on increasing access to child care for children with special needs and for improving the state systems that would help stabilize child care infrastructure nationwide. That's important work. Thank you. Her new book is Bridging Gaps, Implementing Public-Private Partnerships to Strengthen Early Education. Everyone, I think by now knows we are in the middle of a child care crisis, so we are definitely in need of some solutions.
All right. Well, thank you so much, Stephanie. And we're going to talk a little bit today about mixed delivery systems, about public and private partnerships, and how that can affect the child care system. I'm coming to you today from Kentucky. I want to give everybody a little disclosure going on here. Right now, I have power and everything is going well in my world, but we have multiple rounds of tornadoes coming through today. And so if anything were to happen, I may be switching to my phone in the middle of this presentation. So we'll try and keep everything going as best as possible. But again, my name's Sarah Vanover. I've spent a lot of my career in the classroom or leading childcare programs, but the past probably third of my career, I've worked more on administration and helping programs be successful. And right now I spend a lot of my time advocating at our state capitol and asking for policy change around childcare. And so mixed delivery and public-private partnerships, universal PreK, these are all terms that come up a great deal, and there's a lot of confusion around these terms. And so when I sat down to write this book, I wanted to clear up questions, but I also wanted to talk about how a mixed delivery system and public-private partnerships could benefit overall early childhood structure. So that's kind of what we're going to talk about today. Again, we all know that we're in the midst of a child care crisis, and the foundation for this crisis, more than anything, if we're going to sum it up in just a few specific points, is that child care is an extremely high cost for parents, but at the same time, our child care providers make extremely low wages. Kids Count national data that came out last year showed that 98% of other professions make more than childcare providers, and that included dog walkers and many jobs that do not require any level of training or education in order to support the work. The other issue that we're having is because childcare is a hard business to sustain, there's limited access to it throughout the U.S., although working families have got to have a safe and loving environment for their children to be in. So we have a shortage of childcare providers, therefore we have a shortage of childcare programs. And then parents end up having to pay more because they are fighting for coveted spots. With all of this happening, every state in the U.S. is trying to find ways to resolve these issues. Our field does not work based on supply and demand. In retail, when things are popular, you make more, you sell more, you get more profit. In childcare, there are limits to how many children that we can serve based on one center, based on one age group. We have adult to child ratios and things that we have to maintain for health and safety. There's a senator in my state who runs an Easter Seals childcare program. And he always says that his babies need to get a second job because they cause everybody to lose money. We know that infant and toddler care loses money. Our 2-year-olds typically either lose money or break even, and we don't make any money until we get to preschool and school age. And with that combination, with the loss of money and with the slim profits, we try and just put everything together to break even. But many programs are not that lucky, and we see huge financial losses that cause programs to close. So when we think about what we need, what the field needs, what infrastructure we need, we have to find a way to pay a competitive wage. Nobody wants to work in a field where they can't feed their own families if they work a full-time job. We have to prioritize the growth of family child care homes. We have to make sure that everything is not just center-based care. Many of our family child care homes do the lion's share of the work when it comes to night and weekend care, non-traditional hours, care for children with special medical needs or with disabilities that cannot be in large settings because they're overwhelmed. We need to get the business community to buy in to the need for childcare, and some have done it. Some already realize that if they want to attract the best employees, then they need to offer some kind of childcare benefit, whether it is on-site childcare, a childcare stipend, a partnership with a program where their employees get, priority enrollment and discount. But we cannot do this just with state funds and federal funds because there are limits to those. We need to have everybody at the table with the federal government, the state government, the business community, and the families all coming together. We need to make sure that equitable access is available to all children. We have significant populations of kiddos that struggle to get the childcare they need. Some of those are low-income families, but there's also families of children with disability that are expelled or suspended from schools frequently. We see children who do not speak English as their primary language that struggle to find childcare to meet their cultural needs. But another thing that we need is to increase our public and private partnerships to expand childcare access, and that's our main focus today. Now, to do that, I want to give a brief rundown on our 3 main early childhood streams. Okay, so if we're going to think about the 3 main branches of early childhood education, kind of like the 3 branches of government, the 3 main branches of early childhood education include federally funded Head Start, state-funded preschool, and privately funded childcare. And each of those have their strong points and they each have their weaknesses. And so let's kind of go through what we want to talk about on each of those. So we're going to start off just talking about state-funded preschool. Now, state-funded preschool is different from state to state. There's just not a cookie cutter mold to it like there may be for Head Start. Each state can kind of prioritize what they want to cover in state-funded preschool. In Kentucky, we prioritize state-funded preschool for children with disabilities at the ages of 3 and 4, and then for children who qualify for free and reduced lunch when they're 4 years of age. But there are other states that have wide variety of qualifications that they allow for state-funded preschool. The similarities, though, are that the program is funded, controlled, and administered by the state. The program serves 3 to 5-year-olds, typically the 2 years prior to kindergarten. The primary focus is early childhood education and not parent education. We see some parent education programs that might go and do home visits and help instruct the parent on how to work with the child, but state-funded preschool is typically focused on educating and caring for the children and not as a primary parent education tool. Group learning at least twice a week. Some states it's 3 or 4 times a week. Some states it's every day. That's fabulous. It depends on the state's funding and the amount of need. It is different than state subsidized childcare. So, every state gets dollars from the Child Care and Development Block Grant, and that can subsidize early childhood education, but that is typically through private childcare. It is not through state-funded preschool. And then IDA Part B and C services coordinate with state-funded preschool. So we see that child may transition out of a early intervention home visiting program from birth to 3, and then transition to state-funded preschool where they can get special education services there. Again, the components of state-funded preschool, there's resources through the public school system. There are special education services. They may have a family resource center there on site that can support the family with needs. Access usually is defined very easily throughout communities, and it's either by income, by age, by ability level, and then it's typically got a quality component that says, teachers must have this level of education and training. We assess the programs on these scales, and so we see that those are high quality learning environments. Now, the challenges of state-funded preschool is that there are different eligibility and access levels. And that can be challenging. In some communities, they may, like, for example, in my state, you qualify, the minimum qualification is that you have to allow children with disabilities at 3 and 4 to have access. But if the school only the district can only afford 3 hours a day, then that's fine, where another district may be able to offer a 7-hour school day, like the full school day. We may see that some districts have a small community they're serving and enough space where they can offer it to every child and not just those who qualify by ability level. So it can range dramatically from community to community. There's not a lot of wraparound services for families. But like I said, the family and youth resource centers at the schools may be able to support families for meal programs or things like that. But there's a limit to that funding. Staffing is challenging. Every state right now is going through staffing challenges. And then, of course, funding. How much the state reimburses per child determines how long of a day the children get access to, whether it's an AM or PM class, whether they come 2 to 3 days a week. So a lot of those things come into play as a challenge, particularly if the family has to work while the child gets these services. Then we have Head Start, one of our other branches of early childhood education. This is funded through a federal grant and goes directly to a local grantee. So the state is kind of bypassed altogether. Head Start is for kids from 3 to 5-year-olds, but there's also Early Head Start that offers prenatal care up until the child turns 3. There are options for classroom care as well as home visiting, and there are amazing wraparound services that can support the whole family. Medical services, dental services, support services for parents who might need education. Lots of different options. Now, as far as qualifying, this is the smallest group of families that qualify because the family has to be at 100% of the federal poverty level or lower. So these are families that participate in TANF, SNAP, children in foster care, children who are experiencing homelessness. Some spots are saved for children with disabilities, but it is a very small group that qualifies. Components of Head Start. Again, we have educated staff. We have healthcare services that can be offered to children, family care. The supports for the family in Head Start are really one of the most amazing features that they offer that we don't see in other branches of early childhood education. They participate in the Child and Adult Care Food Program. And then there is federal accountability that goes along with the funds that are distributed, which is a pretty extensive process. If you've ever worked in a Head Start program, you know that federal assessments are a big deal, and they come to make sure that every single process and procedure is being handled correctly. So some of the challenges of Head Start. Some Head Start programs have transportation, but others don't. When you're reaching out to families at this very low income, if you don't have transportation, you might not be able to get the families there that qualify. Again, we have limited hours. In most cases, these are half-day services. Some Head Start programs partner with licensed childcare to be open the rest of the day and to use state subsidy. But as far as the Head Start funding itself, it's limited. Infant and toddler care, if you just are Head Start, you might not have infant toddler care associated with the program, and that can make it difficult for families who need that steady stream of care, or there's younger siblings involved. Staffing, again, is very challenging right now for anybody in our field. And then visibility. A lot of families might not know that Head Start is available, or where to go for Head Start, how to qualify. So those can be challenges that they experience. And then our third branch of early childhood education is childcare. And when I say childcare, I mean small businesses that have a minimal amount of government oversight and are primarily funded through parent tuition with some subsidy programs. So the financial structure of childcare, usually in most states, it's like 85% parent funded. We've got childcare subsidy, and then the biggest expense is staff salaries. When you look at the pie chart of how the money is spent, staff salaries is going to be the majority of the pie, and then you're going to have facility costs, some food costs, staff training, construction paper and glue, but staff salaries are really the biggest expense, because what people are paying for is the time of those staff members, the time that the staff members care for their children. The components of childcare. So there are minimal state regulations that are set across the board that you cannot be open unless you meet these minimal requirements. But then we have those additional accreditations, those additional state quality rating systems, what we sometimes call QRIS systems. And they can say, hey, we met the basic stuff, but we're a little bit better than that. We're up here. Oh, no, we're all the way at the top. We're really high quality. And those put a lot of not necessarily stress on the program, but it costs a lot more to have lower ratios, to have higher trained teachers that you're going to pay more. So all of those things come together as expenses for the child care program. And then again, staffing, who you choose for staff in child care. Many states do not have high requirements for child care staff. It varies state to state, but when you look at minimum child care regulations, a lot of states may require a high school diploma. Some states may have high schoolers working with some supervision. Others may require some basic degrees for lead teachers, but nothing extensive. The challenges for childcare, and you can probably recite these automatically, blindfolded and standing upside down on one hand, but funding is the biggest stressor, because the costs are usually more than the money that you take in. Staffing is huge because of the lowest. This is the lowest wage out of any. If you work in Head Start, you're going to make a higher wage usually. If you work in state-funded preschool, you're going to make a higher wage. And so childcare will often find a really amazing teacher, train them, help them to get certifications, and then they may move kind of up the ladder to a higher paying job with Head Start or the public school preschool. Challenges of childcare can also be offering it when parents need it. Most childcare programs open like 7 a.m. to 6 p.m. or somewhere in that option, Monday through Friday. But do we have care available on nights and weekends? If you're a parent who works retail, if you're a parent who works in the hospitality industry, is there care when you need it? Infant and toddler care, again, is an issue. There are childcare programs that are not licensed for infant and toddler care because they know they're going to lose money. They may start serving children ages 2 and up, just because of the needs that are placed on them. It's very challenging to care for children with special needs in private childcare most of the time because the teachers do not have training, and because if a center is really supporting a child with special needs, it may mean that they have to reduce the overall ratio of the classroom and then reduce the income that comes into the program. And then another big issue is childcare in rural areas. In rural areas, many times families are spaced so far apart, and transportation is such a big issue that it can be very challenging to get enough families to enroll in a childcare center to keep the center open. So family childcare homes typically do better in rural areas, but again, are they available? So with these 3 branches, with Head Start, with private childcare, with state-funded pre-K, what we want to think about is, what is a mixed delivery approach? And basically, the definition that I'm going to use for you is that you take any of those 2 funding streams and mix them. You mix the money and you mix the program requirements to meet the highest level of requirements. And that is a mixed delivery approach. So if a state-funded pre-K and a Head Start program blend money together, serve kiddos from both entities, but meet the highest level of requirements, then that's going to be a mixed delivery approach. Private childcare blends with Head Start to do the same thing. Private childcare blends with state-funded preschool. Now, it's not that hard when state-funded pre-K and Head Start blend together because they have some pretty high requirements on both sides. They may just have to change. Head Start may have to offer additional supports for special education. State-funded pre-K may have to offer some additional family supports, and they can do that when they mix funding streams. It is much harder when private childcare blends with state-funded pre-K or Head Start because the requirements are going to be much more challenging. But they also get those funding streams mixed so they can use those supports that way. So how does it work? When we have mixed delivery, particularly when we incorporate private childcare, a lot of times we get consistent year-round care. And this is something that's missing a lot of times from our state-funded pre-K and our Head Start. Both of those operate on school year calendars a lot of the time. Or seasonal Head Start may operate slightly different timeline. But when we can blend these funding streams, we can offer consistent year-round care that working families need in order to be as independent as possible. We can offer equitable access for more children. Our teachers are trained on how to work with different ability levels, on how to work with different populations of children, and then more children would have the access that they need. And again, well-trained teachers overall means that the classroom is going to move smoother, whether that is teachers that have more experience with behavior management and how to run an effective classroom, whether it's teachers that have more training with special education, or teachers that may be bilingual and can support more families. When we blend these programs together, it becomes more affordable for families because state-funded pre-K and federally funded Head Start can offset the cost of tuition paying. And that makes a huge difference for our families that are struggling to pay for childcare. It also allows some family choice because if you are going to state-funded preschool, you're going to go to the facility closest to you. If you're going to Head Start, you typically go to the one closest to you. But if you are selecting a private childcare program that is part of a blended mixed delivery system, then there's more choice on whether it's in your neighborhood, whether it's closer to your parents' place of employment, whether it's culturally sensitive and it has multiple languages represented, whether it's a faith-based program, whether it's a community-based center, whether they have special education training. And so parents are more likely to be able to get what they need when they have multiple options, particularly when it comes to half-day, full-day options for our working families. And like I said, different cultural models. So flexible hours is a big deal, and we've seen this so often in the past few years because we've had so many adults leave the workforce. But when we know that there are full day hours available and that's more flexible than just a 9 to noon a.m. preschool or a 1 to 4 p.m. preschool, then our families have a lot more availability. More resources is also a big option, because if you enroll in a program, a private childcare program that's blended with a Head Start, and all those family resources are available. If Head Start can offer child and adult food program, if they can offer resources to families, then those are things that can benefit the whole family. And then again, like I said, there's parent choice in where they want to send their children. And that's a big deal for so many families, to get the right fit for them and to feel safe when they're leaving their young child, the most precious thing in their world. Why does mixed delivery benefit the public school system? Well, for states who have tried to open up public school preschool to every child in a certain age group, say every 4-year-old can come to public school preschool, you realize that there's nowhere near enough space. um, many buildings have to be built to house that many kiddos. And so one of the greatest benefits for the public school system, when they partner with high quality childcare, is that they are not having to reinvent the wheel. They're using these high quality programs that already have developmentally appropriate classrooms with trained teachers, and they can partner together. They can use part of their funding for the children that they can house, but then they can give part of that funding to the high quality childcare programs to support the other children. The other benefit for the public school system is, if we have more children who are going to some type of preschool before they enter kindergarten, then we're going to be able to identify disabilities earlier. We're going to be able to get early intervention earlier. There may be children who do not need special ed supports by the time they get to kindergarten, or we just know that we have more IEPs in place for continuous support. How does this benefit private childcare? Well, the biggest benefit for private childcare is another stable revenue stream. But there are other supports, like supporting children with disabilities. The public school system, again, really has the most experience on supporting kiddos with disabilities. But if a private childcare partners with state-funded preschool, then those special ed teachers can come over and support the private childcare program. They can train the teachers. They can check in on the children and give them supports. They can help to make sure that IEP goals are met. We also see more diverse communities in private childcare whenever we make this partnership, because it isn't just the children that can afford to be at that program. We're going to see families of many different backgrounds. And this extra funding, this stable enrollment from a wide variety of families could be one of the potential ways that we stabilize our fragile childcare system. How does this benefit the children? Well, part of it is a consistent environment. We know so many kiddos that cannot do well when they have to switch during the day. They go to public school, preschool, then they get put on a bus, then they get sent to childcare until mom and dad can get there. They do that 2 days a week, but 3 days a week they're there all the time. But then in the summer they have to be the childcare program. Those kinds of environments can be really overwhelming for children. I have an 11-year-old with autism, and that was not an environment that he could have handled. We needed for him to be in the same classroom with the same teachers every day. And so a mixed delivery system can really support that kind of consistency, where children know where they're going each day and who they're going to work with. Again, there's specialized care for children who need it. That may be a dual language supports, that may be special education supports, and it may just be the consistency that they need. Now, we've talked about mixed delivery, but I really want to emphasize public and private partnerships. And that's a specific kind of mixed delivery, because it means a private childcare facility that partners with a government funded agency, whether that's Head Start or whether that's state funded preschool. So in that case, we have public and private dollars partnering together and giving us the best case scenario for those two agencies when we use our strengths and support the kids and the families in the best way possible. The benefits of a public-private partnership line up again very similar to the mixed delivery, but in each case we have a private childcare entity that's partnering with a public program. So that means year-round care, and that includes public school breaks. We're on spring break here right now. So many families scramble to find care for that week when they have to work. But in these partnerships, the private childcare would provide that education and care setting for the children, even if it's not on the typical public school, preschool, or Head Start calendar. And that goes for summer breaks, winter breaks, the whole option. You're going to have hired, educated, and experienced staff, because when these two entities partner together, whoever has the highest standards, that's whoever the standards that you have to meet in order to keep those funding streams. Special education supports would be in place, a teaching environment created for young children, and consistent professional development for the staff members. One of the best models that I've seen on these partnerships is really the Early Head Start partnership model. In this case, Early Head Start, several years ago, initially started a grant for partnership sites that would get so many slots for Early Head Start. And then they would be responsible for all of the Early Head Start procedures and practices, but it would still be within inside the private child care program. And so for Early Head Start, this was 0 to 3, but Head Start also does partnerships with 3 to 5-year-olds as well. But with the Early Head Start partnership model, you followed the Early Head Start adult to child ratios, classroom and staffing requirements. They had physical and mental health specialty services that were offered, healthy and safe classroom standards, all the family and community partnerships that Head Start offered. And it was done typically by the Head Start grantee getting the grant amount, and then the centers would get the per child amount for the number of children, for the number of slots that they had. So say a private program entered into a partnership with a grantee, and they say, okay, we are able to have from our 0 to 3 population, we're able to have 16 Early Head Start slots, and that'll be between infant 1 and 2-year-olds. So we'll put them in different classrooms based on age, and then they get that per child amount, and then they get those pluses of the Early Head Start program, like the mental health and disability supports, or the classroom materials, or the additional training, or particularly the family supports that Head Start offers. The adult to child ratios for Early Head Start is maintained instead of what the state minimum would require for the private child care program. But with that additional funding from Head Start, they would be able to maintain those ratios. Now, with Early Head Start, those children would not pay, because Head Start and Early Head Start is free to those who qualify. So the families would not be charged a tuition by the child care center, but they would receive the funding that comes from the federal government directly to the grantee. And how they distribute that is based on the contract with the grantee, whether it's in lump sums or whether you're going to do monthly payments based on that. But those slots would remain filled throughout the year with the children that qualify based on the Early Head Start standards. There are lots of other ways to do partnerships, but this model seems to be a consistent way to support kiddos, because the private child care program now knows how many children that they should expect to have from the Early Head Start model. They also know what kind of funding they get per child. They know what kind of things to offer. Whereas I've seen some programs that might say, okay, we're going to partner together, and the child will be here with us for half the day, and then we're going to get a bus and we're going to send them to you, and then you give them support for the rest of the day. And there's lots of different moving parts all the time. But with the Early Head Start partnership model, the children were at the private child care center for the whole day with a consistent classroom, consistent teachers, and then the per child funding supported them. So benefits of this model. It operated outside of the typical Early Head Start hours. So with Early Head Start, you can offer 6 hours or more, but some programs only offer the 6 hours. In many child care programs, they're open 11 to 12 hours a day. So working families would have access to that 11 to 12 hours a day of support. Families had more choices. There may only be one Early Head Start center in their city or their community, but there may be multiple child care programs that they could choose from. They could be close to one in their neighborhood. They could be at one that's close to a place of employment or where they know more families. Just lots of different options that would give them the choices that they need. improves the work environment for the staff. The staff are getting more training. They're getting the materials that they need. And then the classroom environment is improved for the children. The ratio is lower, and it's made for that age group, and they get those resources that are available. The challenges, well, when you partner with two programs, no matter which of the mixed delivery programs they are, it's a challenge for both programs to learn how to meet that higher level of standards. So there's a lot of coaching that goes into, okay, you've always done it this way before, but now we're meeting this even higher mark. And it's going to be great for the kids, but we have to get used to it first. Another challenge with mixed funding streams is that you have to document which funds you're getting from which program. And a lot of us learned about that during the pandemic when we started getting American Rescue Plan funds. And the state accountability would say, okay, I need to see what you're getting from your stabilization payments. I need to see what you're getting from regular tuition and those types of things. So it requires a little more planning on the program administration to be able to keep track of where the funds are going and how they're being used. And then another piece is getting administrative and staff and community buy-in on why that these partnerships are beneficial, because we want everybody in the program, all the staff members need to realize that this is great for the kids. It's great for the program. If the program is financially stable, then I'm going to have my job. But it is typically going to be more work when you start meeting more standards. And so that can be an adjustment. I want to really differentiate that mixed model delivery, public-private partnerships is different than universal pre-K. And I think this is one of the biggest myths. I know that I had this conversation so many times during our legislative session this year. But I think childcare programs are often confused about this too. And we want to know that it is two different options. Mixed delivery is when two of the three models, or maybe three of the three models, all blend their funding together. But universal pre-K is pre-K for all. Whoever qualifies will get a spot. Nobody is turned away if they qualify. You can have just a few schools that participate in mixed delivery. But if you implement universal pre-K in your city or in your state, then you have to make sure that the children that are eligible have places to be. So according to Neer, who is one of the experts on this topic, children are eligible by age for universal pre-K, and it is not by family income level. If you say we've got universal pre-K, then you're saying every 4-year-old in our state or every 4-year-old in our city is going to have access to this. Or every 3 and 4-year-old, depending on how much money you've got to fund it. And all children within that age range have to have an enrollment slot for it to be universal. I know a state very close to us in Kentucky opened up preschool and really expanded preschool significantly in the past few years. And every 4-year-old was allowed to be in a lottery in order to accept a spot. But not every 4-year-old could go. It was only based on the lottery. So that's not a universal option if not every 4-year-old gets to go. It's a significant expansion, and they were doing amazing things. But it's only universal if every eligible child would be allowed to attend. And we also often think of universal being 70% of eligible children actually enrolling, because you're always going to have children that are eligible that are not going to want to participate. You're going to have families with a stay-at-home parent or stay-at-home grandparent that want to educate their children at home up until they start kindergarten, or maybe want to educate their children at home until they graduate from high school. So not everybody is going to want to participate, but we really look at the goal for full universal to be 70% of eligible children actually taking advantage of the opportunity. Components of universal pre-K, and these are all things that you have to consider if you implement universal pre-K in your state or your city. What are the hours of operation? Is it going to be universal for half day? Because you're going to have far few people that take advantage of it than if it was universal full day, because of all the working families that would need to, they wouldn't be able to leave work in the middle of the day to just move a child from one location to another. How much per child funding would that be for a universal system? Right now in the U.S., if you look at everybody's systems for state-funded preschool or universal systems, a slot per child could be as little as $2,200 per year, which is half day, up to $15,000 annually, which is a full day in one of our wealthier states. So you have to figure out in the state or in the city what that per child amount is going to be and how much of cost that can cover. And that would determine the hours of operation and the frequency that that child would be able to attend during the week, whether it's 3 days a week or 5 days a week. Is it going to be a mixed delivery model, or is it strictly in the public school system? You could do universal pre-K strictly in the public school system and it not be a mixed delivery model. However, it would have significant fallout for the rest of the early childhood education system. Based on what we talked about earlier, the only money that is made in a private childcare program is with the 3 and 4-year-olds. Every other age group loses money. So if your state says, I'm going to take all the 4-year-olds out and offer them universal pre-K in the public school system, and it'll be free for all of them, then private childcare has nothing to make money on. They're going to lose significant amounts of money and close. That whole industry will basically close down. And that's great if you're a 4-year-old and you have a spot in the public school preschool universal program. But infant toddler care basically just goes away at that point. So states that have successfully implemented universal pre-K have done it in a mixed model delivery system where they partnered with high quality private childcare programs, with Head Start, with state funded pre-K, and had lots of options. Now within the book, I put a lot of different examples of different states and how they're doing it. And so you can kind of dig deep and look at states that were really successful, states that were pretty successful, but had some issues and then grew and learned from their mistakes. But for this webinar, the intents of it, we don't have time to get down into the nitty gritty. You have to think about teacher education requirements and compensation in a universal pre-K system. Is everybody going to get paid the same as the teachers in the public school system? Or if you're going to have a mixed delivery system and the teachers in the public school system are going to get paid more, then the teachers in private childcare Head Start might not want to work in those areas and be a little bit disgruntled to partner because they're viewed as less quality of teachers. You have to think about classroom ratios and sizes, how many children are going to be served in the program, how many are going to be served in one classroom. And then you also have to decide if it's based on the school calendar year or year-round care. So those are all components to think about with universal pre-K. The challenges: cost and supply of staffing. Again, most of our income for anything in early childhood education is paying the teachers, because the teachers really are what people are paying for. The other thing to think about, like I said, is the fallout on private childcare. What we want for a mixed delivery system to do is to supplement childcare to stabilize the industry. If people use a universal pre-K system without including private childcare in it, then that is going to be a devastation to private childcare. And it also will mean that there is no quality infant toddler care. So we have to keep that in mind as we move forward. We want to consider adequate funding at the statewide level, whether we're using developmentally appropriate practice. We don't want to see 4-year-olds, 3 and 4-year-olds sitting down doing photocopy sheets and coloring inside the lines. We want to see that this continues to be play-based, even if it's partnered with the public school system. We want to make sure that our public school preschool teachers are trained as preschool teachers and not a 5th grade teacher who agreed to partner in this. And then we also want to offer care at the times that the family needs it. So that's kind of my rough discussion on what it is, what mixed delivery is, debunking some of the myths, but I'm happy to answer some questions today. Again, the book itself gets much down deeper. It talks about an implementation plan. It talks about how states, specific states have done different things. So if you have a lot of questions on implementation, then I would look towards the information in the book. But now I'm happy to answer questions.
So, Sarah, we've gotten some really good questions. Kim wants to know, she says she's heard that programs are often hesitant to rely on non-local education association placement because they can't guarantee that specific placement is going to be the best option. What are your suggestions?
So a lot of mixed delivery systems have a unified application. Particularly if you have a city that's doing a mixed delivery system, like a universal system, or a state doing a universal system, there may be one application system. And a family that's going to apply, instead of getting on the wait list in different places, they would apply and say, these are the things that I need for my family. I have a child with special needs, and so we really need to be placed somewhere that somebody has experience working with children with special needs. Or I have a child that really needs to be in a smaller classroom because they have sensory overload and things like that. And again, that's one of the reasons that the mixed delivery system can give families more choices. Sometimes children who are very overwhelmed in large setting might be placed better in a family child care home. And family child care homes are, part of the mixed delivery system. So when we get that unified application and parents can put in the information on things, I need full year care, I need full day care, and I also need smaller environment for my child, then that family choice piece can help determine what might be a good fit. And we'll have other families that'll say, hey, I only need half day. We have a more flexible schedule, but I'd like it to be close to my house. And so, there's going to be a variety of questions, but really a unified system that lets people put in their requests really allows for that mixed delivery system to work successfully. And we see that even in small settings, like in where I live in Lexington, Kentucky. We don't have universal pre-K. We don't have a large mixed delivery system, but our public school preschool does partner with 2 or 3 private childcare programs that have very particular backgrounds to support kiddos. And so when a child goes and applies for public school preschool, if they really need that type of setting, then the school system may direct them to that.
Yes. So Kelly wants to know if you have to follow a particular curriculum.
The most of the rules, again, are going to be based on the highest set of standards. And in most states, the highest set of standards is going to be your state-funded pre-K or your Head Start. Most don't have a specific curriculum like that you purchase, but they do have components that are required. So for Head Start, you're going to have, a weekly lesson plan, but you're also going to have daily lessons and goals that you're trying to meet for each individual child. And so you'll line that up with the private program that's partnering with it, or with the public schools requirements. There may be a state-funded public school that says you have to use creative curriculum, or you have to use the AEPS for a developmental assessment, and so that could come into play. But as far as the general model itself, you're just looking at meeting the highest set of standards between the entities that are blended together.
And how would you start a partnership? How do you get involved?
It's going to depend a lot, but a lot of it is communication between a local school district or between your local Head Start grantee. We have a lot of partnerships in my area between the Head Start grantee and private childcare. And some of it is just the child care program reaching out to the Head Start grantee and saying, hey, we would love to be a partner. Come and look at our place. We could try it out next year and take 10 slots if you had them, and you could see if it's a fit, and we could eventually take more kiddos. For private childcare, the same kind of partnership may work with the public school system if you reach out. Other partnerships are initiated by legislative changes. If you have a legislative change that says, the state is going towards a mixed delivery system, and the school system is going to get 30% more if a third of their kids are in a mixed delivery format, then that's obviously going to be a change that is going to have to be looked at statewide. In rural areas, sometimes that can be challenging because in Kentucky, we have at least 2 counties that do not have private childcare. So if there was a mandate to have a mixed delivery in that county, it could be more challenging if the only thing that's available is public school preschool. It also would be incentive for somebody to open a private childcare if there was a need there. So it depends on whether or not you're just trying to start a partnership with your organization and another organization, or if this is coming down from a higher place, a mandate, and you're trying to get in line with that.
Let's see. Karen wants to know what happens with the PreK students.
With the 3-year-old students?
I think she means 3-year-olds, yes.
Well, it kind of depends on what type of system that you use. So our blended Head Start programs here that are Head Start partnerships, 3 and 4-year-olds both are able to have slots as part of the mixed delivery system. I use 4-year-olds as an example because some states have done universal pre-K just for 4-year-old students because they can't afford 3 and 4-year-olds together. But in most places, if you have a partnership with preschool and private childcare, Head Start and private childcare, then 3 and 4-year-olds would be able to participate based on the eligibility of those organizations. So like I said, in Kentucky, you can be a 3-year-old and qualify for a state-funded preschool if you have a diagnosed disability. But 4-year-olds qualify if they qualify for having a disability or for income level. So there's fewer 3-year-olds that would qualify, but they would still be available to if they met those qualifications. A lot of it just has to do on the eligibility requirements set by the state, the federal government, or the private child care. And if you enter into a contract, say a Head Start grantee enters into a contract with a private child care, Head Start serves 3, 4, and 5-year-olds, but maybe in your program they're just looking to serve a certain age group, or the contract says you can serve 3, 4, and 5-year-olds. Individual contracts may put some additional stipulations on it, but as far as the overall scheme, it really falls in line with what the eligibility criteria is at that top state level or at the top federal level.
And to wrap it up, Meredith would like to know if you can offer a concrete example or two of a successful mixed model.
Concrete example.
I think perhaps maybe from your book.
There are different states that have done this really well. Georgia's one example. They have a mixed delivery statewide system. They get some funding from lottery dollars and several other places, but children are eligible to apply, and they enter that way. Tennessee has mixed delivery, but it's not universal, and you're able to apply there, and then they'll pick children out of a lottery and offer that. There are other states that have great mixed delivery systems, like New Jersey, where a lot of kids are served. And then there are cities that do it independently. Like I said, Kentucky has 120 counties. We have one county right now, our largest city, Louisville, where the Derby is held, that is in the process of trying to offer universal pre-K just in Louisville. And they're setting up that implementation system right now. So it doesn't have to be a full state. And as I mentioned, the city of Lexington has mixed delivery with our public school system and just 3 or 4 other schools. So you can do this at a very large scale, or you can do it at a small scale. The idea is that those extra dollars from the state or federal go into the private child care, but private child care supports the other entities by offering the hours, the seasons, the time of year that the families need. And then they really kind of support each other's strengths and weaknesses.
Sarah, thank you so much. This has been a wonderful presentation. We've had some great feedback so far. I'm very excited. Don't forget, if you want to purchase a book through Griffin House, we're offering 20% off. Just use the code BookChats when you order. And then don't forget to register for our next edWebinar, Simple and Effective Strategies to Support Executive Function Skills in Young Children by Dr. Julie Terigny. That'll be May 2nd at 2 p.m. Eastern Time, and you can register on edweb.net. Thank you so much for attending, everyone.